Tyler Watt is a Liberal MPP and notably also a registered nurse. Tyler Watt's nice to have you. Good morning.
Good morning, John. It's great to be here.
Okay, so what's going on here?
Well, we are seeing massive financial pressures being put on hospitals and seeing cuts of nurses throughout Ontario, right? More than 70% of Ontario hospitals have been forecasting deficits and having to use reserve funds to continue operating expenses. But when they're being told by the government to find efficiencies, it's really unfortunate that nurses are being, cut and seen as numbers that way.
Does this, is part of a factor in this, I guess, the disrespect that nurses have customarily received in the medical profession, that it's sort of, I'd like to see the doctor, but I got the nurse?
Well, there's always a theme when I'm speaking with nurses about, how do you feel working in this current system that we have? Because it is way worse now than it ever has been. I don't really think that we ever fully recovered from COVID. And one of the things that nurses share often with me is that they feel disrespected by this government, right? Bill 124, for example, freezing our wage increases at 0.9% during a pandemic wasn't exactly, the kindest thing for this government to show. And now people are worried about whether or not their job is on the line.
And I have to ask, how does this necessarily impoverish the system? I mean, it's one thing to cut in order to save money. It's another to be able to actually meet the needs of what nurses are doing.
Well, exactly. And I'll be honest, hospitals are already operating with less than the bare minimum. Nurses and healthcare workers often punch above their weight. It's no secret that emergency room wait times are getting worse and worse throughout the entire province. And for me, I just think that this government has its priorities completely backwards. The way that we solve this solution is by investing in community, investing in access, investing in prevention, anything we can do to actually stop people from getting to the hospital in the first place, whether that is a health crisis they're going through or the hospital being its only choice for those patients to go to. For example, over 30,000 people in my riding of Nepean don't have a primary care provider through a nurse practitioner or family doctor.
And how many positions are we talking about here?
Well, there's just since January of 2025, over 1,300 RN positions have been cut in Ontario.
And is this like many other situations in Ontario medicine, which is that the regions and the north are being punished more than elsewhere?
Well, we are seeing it across the entire province. I mean, just in Ottawa specifically, TOH had announced a bunch of nursing cuts. We have Queensway now. St. John's Hospital in Hamilton announced some cuts, Sunnybrook Health Sciences. And any cuts that will be happening in Northern or rural Ontario will certainly have an even greater negative impact on patient care.
And perhaps this is an incendiary way of asking a question, but I imagine that in this quest to save money, executives and administrators are not being cut.
I'm not totally sure. I'd have to look at actually what the efficiencies each hospital has been doing. I know Queensway Carleton in particular has been doing a good job at trying to find efficiencies in their operation costs. And it's just unfortunate it's come to this point, though, right? This is why the Ontario Liberals called for a $1 billion injection into the hospital sector. And again, this is not a permanent solution. This is a Band-Aid solution. The only way that we get out of this and how much money we actually do spend in hospitals is investing in community. For example, nurses in the community are not paid the same as nurses in hospitals, right? So if we want to attract talent and expertise into the community, we need to ensure that we have that pay equity there.
And just out of curiosity, I know Adil Shamji, who is a Liberal MPP, still pulls shifts in a hospital emergency room. Are you still pulling shifts as a nurse?
I do. And now that we're away from Queen's Park for nearly 5 months, I have a bit more time to do that.
Thanks a lot for this. Good to have you.
Yeah, my pleasure, John. Have a great vacation.
Thank you. That's Tyler Watt, Liberal MPP and a registered nurse.